Hello, I'm Dr. Rajeshwaran, consultant endocrinologist and bariatric physician at the London Obesity Clinic. I'm also the director of Simplyweight, which is a global medical weight management organization. I also work in the NHS, United Kingdom. So we started this series where we talk to experts in obesity to help unravel the secrets. As you know, the prevalence of obesity is increasing worldwide despite an intervention nearly every week. There's a diet every week, but then they're obviously ineffective in the long run. So our intention is to talk to several experts to unravel the mystery. A few days ago, we spoke to a cardiologist, but now we have a medical psychologist who is world-renowned, Professor Andrew Hill. Professor Andrew Hill is a medical psychologist at the Leeds University. His area of expertise is obesity and weight management, eating disorders, appetite control, young people's mental health and well-being. He completed his PhD at Leeds working with Professor John Blundell. And thereafter, he was awarded a personal chair in 2006 and was head of the academic unit of psychiatry and behavioral sciences from 2008 to 2017. He's also a honorary professor at the Borden Institute of Obesity, Nutrition, Exercise and Eating Disorders at the Sydney University School of Medicine. His current activity is focused on the following, which is psychological issues in obesity, dieting and weight management, eating disorders and disordered eating, weight and shape self-perception in children and adolescents, appetite control including food craving, young people's mental health and well-being. As you can see, he's got a huge range of experience, especially in weight management and the psychology behind it. I've learned a lot from him whilst I was training at Leeds. So we are very fortunate to have him. So let's kick off. So Professor Hill, you've got a wide experience in the psychology of obesity. I know you've written lots and lots of book chapters, and as I was training in diabetes and endocrinology, we followed your advice in managing patients with obesity. So what are the common psychological issues contributing to weight gain?
That's a difficult question to answer very briefly, but I just thought I'd sort of divide it into sort of the specific and the more broad things. I think specifically, just realize how we use food and activity to change how we feel about ourselves every day. Food is one of those things that's still pleasure. It's still one of the life's free pleasures. Eating for most of us most of the time is a pleasurable activity. And when we're required to change it in any way, then we lose the connection with that pleasure. So you're not allowed to eat the foods that you would like to eat. You've got to eat them in smaller quantities. You've got to eat them differently. You maybe have to eat them differently to people in your own household. So that is a real challenge. And I think the other challenge is in relation to activity. You know, most of us like to sort of be reasonably active during the day, but the thought of going out and running or doing even Joe Wicks routines every morning, you think, oh my goodness me, you know, that's effortful. And once you get into a routine with things, particularly with activity, they then become enjoyable, at least once they're finished. I think more broadly, we have to sort of think about food. Our food intake and our activity patterns are habitual. In other words, they're automatic. We don't really think, we don't make a lot of choices about them. We just go through the sort of routine. a lot of our behavior is based on past experience. So we have a whole experience of a relationship with food. And to change that now is really quite difficult when we've had a whole history of a relationship with food. It's a real challenge. So actually, you know, if we sort of go to the default, we just go back into what we do all the time. What weight management is trying to do is to teach people new habits, to install new attitudes, new feelings about food and how we eat and where we eat and who we eat with. That's very, very difficult to change. And so in terms of psychological input, it's about giving people strategies to change their habits, change those lifelong practices with relationship to food and with relationship to being active.
No, thanks, Professor Hill. So, as you said, it's not easy, and whatever habits they've learned through the years, and trying to give them new skills and new techniques is not going to work so fast. So, as you know, in weight management, anyone coming or anyone wanting to lose weight, the first step is go and eat less, eat small portions. So in the NHS, that's what we do. And we do support people. But do you think there should be any new change? Do you think it's just outdated? My opinion is that a lot of my patients know exactly how many calories are there in a Greg's sausage sandwich. How many calories are there? They all know that. So when I'm telling them the same thing, they try to distance themselves from me and they stop coming to my clinics. So that's my worry is I want to make them come to me, but what should I do some different? That's my concern.
I think that's really, really tricky. I think lots of people have tried weight loss or weight management before they come to see you.
Yeah.
They've gone through a whole set of different strategies and lots of information out there. And while it may seem very simple, simply to eat less or at least eat differently, I think that's really the message we're trying to get over to people. And they've been to different, they've tried different weight management regimes and they've in the end not worked. Then they tend to sort of dismiss them and say, well, they're never going to work. And I think we have to recognize that things work for us at different times, okay? And just because you've tried a particular approach in the past and it wasn't particularly successful, doesn't mean to say that it won't be successful in the future. Are you in the right place? Are you in the right place at the right time? Go back to some of those strategies that you did before and don't just dismiss yourself as a failure. Just recognize there are multiple things going on in your lives and it may not have been the right time at that point. I think we also have to be quite sophisticated about goals. People come to see you because they want to lose weight. Okay, they may want to manage their diabetes better, but they ultimately want to lose weight. Now, weight loss is what's called a distal goal. In other words, it takes quite a long time to actually have a meaningful loss of weight and to maintain that loss of weight. Now, I'm not saying weight shouldn't be the ultimate goal, but there are other things that people need to see as achievements in terms of what they've done. So changing one's selection of foods, liking new foods, having smaller portions, eating differently, and to actually maintain that over a period of time is itself a really important goal. I think managing other health problems. So if somebody has type 2 diabetes, for example, actually getting better glycemic control is a really important goal. That may, the weight change may not be really profound, but it's a mechanism for helping one to feel better. So more sophistication in terms of goals, what is rewarding, but also to recognize that change takes quite a lot of time and to reward yourself in other ways and not just look at the scales every morning of every week.
No, thank you very much. I think that was a very good advice. So what you're saying is just don't be fixated with the weight, the number on the scale, and try and do other things which would help you. Is that
Yeah,
right?
yeah. I mean, most weight programs sort of will last 12 weeks, will last 3 months, may last 6 months, and it's that sort of sustained change that we should be looking at in terms of weight. But people need rewards on a daily or a weekly basis, and so they need to look at those things in their lives that they are doing differently that are important to them as part of the program, and that's the way to stick on programs.
Thank you very much. So you have written a lot and lots and lots and done a huge amount of research in the field of psychology and obesity. So to me, as a practicing clinician, are you advising me that there should be a psychological intervention for every patient? Is that mandatory?
That's an interesting idea. I don't think there are enough psychologists to go around, Raj.
Yes.
But I think a lot of people who work in weight management, who work clinically, use psychological strategies anyway. And I think there are a whole set of these which, if used appropriately, delivered appropriately by clinical services, but taken on board by people wanting to do weight management, that can be really helpful. I've talked a little bit about goal setting,
Yeah.
and that's one of them. You know, setting achievable goals, and ones which you don't feel devastated if you don't meet every day. Stimulus control, the very straightforward behavioural strategy in weight management. If you surround yourself by all those foods you're not supposed to eat, then actually it's, you know, you're surrounding yourself with those temptations. I mean, actually changing one's food environment is a very straightforward technique. Reinforcement, so finding rewards in things that are other than eating, other than food relating, finding rewards which are in activity, and that, you know, that activity may mean walking around, maybe walking the dog a couple of extra times. It may be walking to the supermarket, buying less because you can't carry it all back, you know, in a lighter shopping bag. So it's actually tailoring what you enjoy in your life to something which is achievable in your lifestyle. Stress management, we're in a very stressful situation at the moment. Weight management itself can be really stressful. Having distractions, having ways of finding relaxation, and there's lots of advice out there. If you're thinking about food, if you're feeling hungry, you want to eat something, you're thinking about food, finding some way of distracting oneself away from either those thoughts, or finding a non-eating place in which you feel comfortable, using relaxation as a strategy to do that. I think the other issue for me that always comes back in terms of psychological intervention is that when people come to you for weight management, they've actually got lots of other things in their backpack that they would like to sort out. And sometimes it's those things that are going on in their lives that are interfering with their weight management. Now, you can't, in your setting, sort those out for them, but a psychologist can. Okay, now whether that needs to be part of a weight management practice, or maybe people need to recognize, well, actually there are things that are going on in my life that actually make it really difficult for me to engage with my weight management plan at the moment. I have all sorts of stresses. I may have a depression, I may have an anxiety. Now, if I was to go and seek psychological intervention, go to my GP or get referred on, then actually managing some of those issues may make me more able to engage with a weight management program. So I think that's where psychology can be really quite helpful too.
All right, thanks, Professor Hill. So actually you answered my next question, which is, when does a psychologist come into the whole process? So you're saying is when they are anxious, depressed, or when they really think that is playing a major role. Is that right?
Yeah, and I think there's a sort of timeline. I think it's quite helpful for a psychologist potentially to be involved in the start, because they can look at what somebody's motivations are. They can sort of help people review what they've done in the past and what might be useful in the future. They can help to troubleshoot. I think when people sort of look and see what they've done in the past and what's been successful, they can start to take ownership of changing the issues themselves. You are a very wise clinician. You've lots of experience, but in a sense, you can tell people what you think they should do, but they need to be their own problem solvers. So there's a strategy called motivational interviewing, and I'm very supportive of that. But ultimately, what that says is you need to help yourself in terms of self-help. All of this behaviour change has got to be self-help. It can be supported by you clinically. You can give advice, but actually the person who's most expert in what's going to work is the person who's trying to do the weight management. Yeah. And so you may be in a situation where you could offer different types of strategies or advice, but they ultimately need to make the choice. Then they need to go out and try it. If it didn't work, they can come back to you and discuss other strategies that they might use. So that's a particular sort of way that psychology can be involved in weight management. I talked about mood and mood disorders, but people have social lives, and sometimes one's social setting, the family environment or work, can actually be quite problematic in terms of making behaviour changes, and psychology can come in there and again offer different routes for solving some of those problems. How are they getting in the way? What might you do to change those situations going forward? So I think that psychology can be involved right at the beginning, but at any point during the process. But again, going back to, if there are cardinal problems like mood problems, like an eating disorder, I mean, some of the people that you see probably have some form of either compulsive eating or binge eating problem. Now, for you to manage that is a different challenge. Whereas, there are psychologists who have expertise in helping people to manage their binge eating problems, and then can go in, are more likely to be successful in a straightforward weight management program.
Well, I'm just trying to recollect what you said. Every line of what you said had a profound meaning in it.
Thank you.
It's serious, because everything you said was absolutely being in the cold face of weight management. I mean, one thing you said was, if the person comes back the next time, they need to think back. Probably they were not at that particular time and place. Now they may be in the particular time. I didn't think of that sort of. So you made me think now. And
I've heard so many people in other settings who say, I've got a depression, but I've had CBT in the past. Yeah. It doesn't work. Yeah. Okay. And my take on that is, there are all types of different CBT. One of the key things about any psychological therapy or any intervention is to build up a relationship with the practitioner. Because if you don't have trust in the person who's helping you overcome these problems, then it's probably not going to work. Just because CBT didn't work in the past doesn't mean to say it's not going to work now or at some time in the future. Don't just reject a whole strategy because it didn't work when you weren't ready for it.
Absolutely, absolutely. So I'm going to change my practice.
Don't.
No, seriously, I think that's profound, because what I always worry about is the infrastructure and the funding we have got. We need to do the best for our patients with the limited funding. Yeah. And so we need to be careful. We can't keep inventing new things. So we need to go back and to our desk and say, okay, what can we do best? So that's a fantastic advice. Now, as you know, Professor Hill, that 90% of the people who became unwell with coronavirus infection, those who are ventilated, 90% who are ventilated, 70% in the UK who are in the NHS ICU, they're all obese people. Mm-hmm. So I'm expecting that when this all settles, there's going to be a deluge of people who will seek our help. And so what is your general advice to the dietitians, the endocrinologists, the psychologists and physiotherapists in weight management?
Three broad bits of advice, I think.
Okay.
One is to try personalizing any advice that you give to individuals. People will take things, broad strategies, they will take to them better if they are able to understand how they can be implemented in their own lives. So that general advice, eat less, is the most unhelpful piece of advice. It's a bit like, you know, stay calm, be aware, for example. Be aware, okay? So eat less. So how would you eat less? So spend some time with that individual, looking at those strategies for how people will make changes to their food choices, changes to their portion sizes, and do so in a way that doesn't lose their enjoyment of food and doesn't mean that they have to eat in a different room to the rest of their family. So making any advice personal to that individual is one. Providing support and listening is another key one. We know there's lots and lots of evidence that if all you do is you spend 6 weeks on a weight management program and then that person then leaves the program and goes away, that the impact of the program will quickly disappear. Actually, staying in contact periodically with the person that you was giving weight advice actually helps people to stay on track. It allows, it's a listening voice. It's somebody to check problems with. It's or ask for solutions, or to get some reinforcement, some reward from. So support is absolutely key. And I think the final thing is expectations. We talked about, is this the right time? Okay, is this the right time to be embarking on weight management? Is there other stuff going on in your lives that just are crazy? Or have you got a physical health problem? Is this the right time to do weight management because it can help manage the physical health problem? That might be the right time. What are the barriers at the moment that you feel are going to get in the way of the advice that we've been talking about? Okay, so managing people's expectations, and ultimately making sure people understand that this is a long haul. We grow into a body weight through childhood, into adolescence, into early adulthood, and that body weight then is very difficult to change. And where our weight might creep up gradually during adulthood, quite a lot of people with obesity have found actually they had obesity when in their late teens and when they were adults. And to change that requires such a lot of effort, but actually it requires a lot of time. We've got to have a bit more forgiveness in this system in relation to making major changes to weight loss. We're not we're not going to lose 2, 3, 4 kilos in a week. We're not going to lose 2, 3, 4 stones in 6 months unless you have surgery. Okay, if it's a standard weight management program, those are objectives for 1, 2, 3, 4 years to maintain. What are the things that are going to maintain your engagement with weight management over the next few weeks? What are those small differences, those small changes that are rewarding enough to go alongside 1, 2, 3, 4 kilos over a period of weeks or months? So that's a really tricky one. It's really, really tricky. For the long haul, stick with it. Stick with it as a clinician. Don't just judge your patients because by their weight change. Make other judgments about their engagement with what you're trying to encourage them to do.
Thank you very much. So what I'm trying to learn from you is consider obesity management as a chronic illness. Would you agree with that?
Absolutely. And I think that frame is so critical. Yeah. So critical. It's a chronic illness in the same way that other really significant health problems are. Any cardiac disease, diabetes, they're all chronic health problems which require management. You don't simply take an aspirin for a week to make it go away. These are life-changing illnesses, and I do regard particularly severe obesity as an illness. But it's chronic. Chronic means it will go on, it will persist, it will come back if you undo all the good things that you did to help it resolve.
Thank you. Thanks a lot, Professor Hill. I mean, more than an interview, it was a teaching session for me.
Well, thank you, Raj. It's always good to talk to you.
So, thanks a lot. Thank you very much. Very kind of you to have taken some time of your busy schedule.
All right.
Thank you.
Bye-bye.
Bye.